Hi everyone, my name is Larissa and I'm going to be describing and detailing my scenario that I made for my medical scenario that I created, which focused on my end goal of becoming a PA. I'm wanting to go into women's healthcare, specifically OBGYN. So my dream is to support women through every stage of their reproductive health, which includes fertility, pregnancy, gynecologic conditions, and even surgical care as part of my hopes and dreams. In the scenario that I created, I take you through a typical day as an OBGYN PA working in multiple settings, which include the clinic, the hospital, and operating room. And I also mentioned in my scenario community outreach. So in my morning, my scenario, I start in the clinic where I evaluate a pregnant patient experiencing unexpected third trimester bleeding. On this patient, I did an exam and an ultrasound, and I became concerned for placenta previa. And I also noticed signs of edema and pregnancy-related hypertension. In the scenario, I was monitoring her and she experienced a brief episode of tachycardia, which then I was watched closely to make sure it didn't turn into arrhythmia. She then was transferred to labor and delivery for further monitoring to keep both her and the baby safe. In my scenario later that day, I headed to the hospital for scheduled procedures. My first case in my scenario is a hysteroscopy to investigate abnormal uterine bleeding. During that procedure, I helped obtain a biopsy and repair a small cervical laceration that happened during the exam. After that, in my scenario, I called to assist a laboring patient who had slow dilation and whose labs show leukocytosis, which would indicate an infection. So in my scenario, I collaborated with the OBGYN team to begin treatment and prepare for possible complications. At the end of the day, in my scenario, I ended at the community outreach event supporting women dealing with infertility, endometriosis, PCOS, and other conditions that go untreated due to lack of access to care or people that don't reach out due to financial issues. As a future OBGYN PA, my priority is to advocate for women, just women, because that's what my focus would be, but for patients, provide high quality care and make sure every patient feels heard and supported. I included those three, which really packed up my day in my scenario. But those are the locations I'm really wanting to be. I wanting to be in the clinic, the hospital, operating room, and it's really important to me to be included in community outreach to help all women who need some type of support and need access to good, high quality care. Thank you for listening.